You know, Brian, when we were together on New Year's Eve, people were talking about 2020 being a portentous year. I think little did anybody know what they really meant by that. That was a mental health crisis that was already full blown. Suicide, substance abuse at unprecedented levels. And then comes the pandemic and the global financial meltdown and the societal and political unrest. It was almost as if COVID threw gas on a fire that was already burning hot. I am very concerned that the health system is going to be overwhelmed by this demand occasioned by mental health and the effect that has on chronic conditions. What are you seeing in your practice, and what do you think we can do about this?
Well, I've seen in my practice, talking with colleagues and in the professional literature, that people are experiencing more fear, anxiety, stress, loneliness, and depression than ever before. Mental health conditions have risen well above typical levels, and the healthcare system is stretched beyond capacity to deal with the demand. Suicides and abuse are on the rise. Loneliness and social isolation are now the #1 chronic disease in America. Unfortunately, this is the new normal.
You know, Brian, we can't approach a new normal with old ways of doing business. We have to support our healthcare professionals to know the whole patient, not just clinical and social data, but the all-important missing data, emotions, moods, and other feelings. We cannot just talk whole person health. We have to walk in the patient's shoes during their entire healthcare journey.
And this is exactly why ADoH Scientific developed our patented Morphii technology and methodologies to more accurately assess, analyze, and track these critical subjective feelings we call emotional determinants of health behaviors. We apply affective science and technology to give new tools to healthcare professionals and the untapped benefits of knowing patients' emotions and feelings that drive individual health behaviors.